infertility is one of the major signs of hormonal imbalance. There's a particular hormone that is being produced when you are pregnant. Whenever the hormone is not available, the womb cannot actually hold a baby for 9 months. So once there is a disbalance in that hormone, you can't bear a child. Okay? That's where infertility comes. Both menopausal women, people who have grown the age of have reached the age of menopause, within that period there is a switch in the hormone. So when that happens, there is these symptoms: fatigue usually setting, tiredness, and even anxiety setting as a result of hormonal imbalance, because there is a shift from the hormone where the stage where they bear children to a stage where they don't bear children anymore.
Welcome to VitalDee. All we do here is to bring health tips closer to your nearest doorstep. So today we're talking about hormonal imbalance. I can assure you that this is one of the topics that affects a lot of people, even the male, the female. In fact, a lot of people have issues with their hormones. Some of them complaining that they are having mood swings. Mood swings could also be a sign that it could be hormonal imbalance. So we are going to discuss what hormonal imbalance entails, starting from what it is, the signs, the symptoms, the diagnosis, the various treatment that you could get. So today I'm going to be discussing this topic with an expert in the person of pharmacist Obute. Welcome to VitalDee Show.
Thank you very much, VitalDee, for inviting me to this program. I hope to have a positive engagement with the viewers and your team.
Thank you very much. I hope you are enjoying your stay so far in Akwa Ibom.
Of course, am I? Yeah.
All right. So like I've said earlier, this is pharmacist Obute, who will tell us more on what hormonal imbalance entails. So we are going to dialogue, because at the end of the day, we want to achieve a positive outcome in which our viewers could understand what hormonal imbalance is. Because most people just go to the community pharmacy shop or a pattern medicine shop and say they're having hormonal imbalance without them necessarily knowing what hormonal imbalance entails. So before we go into this topic proper, I want us to understand what is hormone, or what are hormones.
Okay, yeah, I wanted to even bring that up. Before you could even discuss hormonal imbalance, you actually need to know what is hormone. Well, hormone is actually a chemical messenger in the body system that regulates most of the physiological functions of the body. Things like metabolism, reproductive health. Hormone also helps in regulating your growth. So hormone entails a whole lot of things, which I've earlier mentioned, is a chemical messenger that sends information to different parts of the body to, help me do this, help me do that. It's more like a messenger.
Okay. Yeah. So that means hormone is basically like a messenger in which you can easily send message to pass from one person to another.
Yes, to carry out a basic function in the body.
Functions. Yes. Okay, so at least we have gotten the background in which he said from pharmacist Obute, he said hormones are just chemical messengers in which information are being passed from one point to another. Now, but before, let us have an idea of what is hormonal imbalance, because this is what we are going to center on today. So what is hormonal imbalance in your own view?
Well, from the word imbalance, it means something is not in check.
Okay.
It then means that in ideal setting, the hormone level, there's a particular level at which the body should maintain a particular hormone. Let's say, for example, insulin, for example, is an example of hormone. So there's a particular level at which it should be in your body system. Okay. So if it is lower or is higher, then that's where the imbalance comes in. Okay. Another way we look at hormonal imbalance is, in body system, we have what we call androgen hormone. Yes. That's the reproductive hormone. Then there's what we call the estrogen level. So in man, there's a balance between the estrogen and testosterone. Okay. The same way we have it in female. Okay. So if the level of, for example, if the level of estrogen is higher in men compared to the testosterone, which is supposed to be higher, there's an imbalance there. Okay. Yeah, that's another way we look at the imbalance.
Okay. So basically, we are saying that hormonal imbalance occurs when these hormones are not in check.
Yes, when
one is either higher than the other.
Yes.
Or even the normal parameter in which is supposed to have in the human body is exceeded, or maybe it's lower.
Exactly.
So having this, a lot of people always complain of hormonal imbalance even when they don't know it. Because I can bet you people just rush to get drugs. And we ask them, why are you taking this drug? They say this hormonal imbalance. They want to use it to correct hormonal imbalance. So, like you have rightly mentioned, that it's a situation in which the hormones are not in check. So, I want us to look at what could be causing this hormonal imbalance, because it's one of, I think it's one of the things that is very common lately.
Yeah.
Like a lot of people are complaining of hormonal imbalance. What do you think are giving rise to this hormonal imbalance occurrence?
Okay, like I've said earlier, hormones are generally chemicals. Okay, they're chemical messengers. So when I've observed certain people saying they have hormonal issues, and that's one of the reasons why they cannot give birth, which is very true. Which
Okay.
is very true.
Okay.
So one of the causes of hormonal imbalance is one, medication history. If medication conditions, for example, if you're having diabetes, like I talked about insulin,
Okay.
you know, insulin is a hormone that actually regulates your metabolism, right?
Yeah.
Yeah. So if there is a low level of insulin, there's a high chance of you having a higher blood sugar.
Yes.
So that's an example of medication, medical conditions that can cause
medical conditions.
that can
Okay.
cause hormonal imbalance.
Okay.
One of the other issues here is lifestyle modification.
Lifestyle modification.
Yeah, lifestyle.
Okay.
You know, there are a lot of people who have this sedentary lifestyle. You know,
Okay.
they have this sedentary lifestyle. They don't do exercise. They don't work out. They just eat anything they see. Okay, that's one of the causes of hormonal imbalance. Another cause is stress. Stress. You know, stress have a way of affecting the hypothalamus,
Okay.
which the hypothalamus regulate the hormone production.
Okay.
So if you are stressed, you have if you are overstressed, like chronic stress can cause hormonal imbalance. Another issue is lack of sleep. A lot of people don't rest in this country. They just work. Like even a machine gets tired at a point.
Well, you know the country we are.
I understand the fact that we are in a country where we need to survive and all of that. But at the same time, if you don't take care of this body, you go back to the hospital, and the time that you are using to, or you are claiming to want to work throughout, you still spend that time in the hospital with your money.
Yeah.
So why don't you just take care of yourself? So let me recap again. Medical condition.
Okay.
Even the medications, there are some drugs that actually cause hormonal imbalance. Example is estrogen-like drugs.
Okay.
If you are always on steroids, another classic example is family planning.
Okay.
That's estrogen-like.
Before you go on, you just mentioned medications.
Yes.
Post-pill, for example, in which for emergency contraceptives.
Yes.
Can it predispose one to hormonal imbalance?
Like I just talked about estrogen-like drugs.
Okay.
Which post-pill that you mentioned is one of them.
But most ladies are consuming it like paracetamol lately, because they don't want to use contraceptives, but they feel that they should be taking that post pill or after sex pill. You understand? Like they take it more than they're supposed to take in a cycle. I believe there's a certain number you're supposed to take in a particular cycle, but most people are taking it more than they're supposed to take. Well, and they're also coming down with this hormonal imbalance.
The truth is, every action has a reaction.
I know.
Okay. Every action have a reaction, and post pill, like you say, that's actually a brand name. Okay. Which I don't want to promote any.
No, we are not promoting. That's why we are just mentioning what's in the market.
So like I said, estrogen is more like a synthetic hormone, a reproductive synthetic hormone in body system that tells the body, okay, at this point in time, I don't want you to produce a hormone that will help welcome a baby. So what the body does, if a body is pregnant, there's a particular hormone that welcomes the baby, that prepares the womb, make the body fertile for actually bear a child for 9 months. So what some of this synthetic estrogen does, it helps to prevent some of this hormone that bears children, that prepares the body to bear children. Okay. So when you overtake or when you take this drug consistently, it affects the balancing of the hormone with regards to reproductive health.
Okay.
So it predispose a woman to hormonal imbalance.
I've seen some, when I was practicing the community.
Okay.
I've seen instances where some ladies will have missed period, like they're not seeing their monthly flow when due, and sometimes when you engage them on a meaningful conversation to look for a possible medical history or drug history, you seem to find out that most of them have been taking these pills like like abnormal rate, like they're taking it like day in, day out. You understand? And most of them, if you are taking it for a birth control pill, we will know that okay, you're taking it for a birth control pill, and in which there should be proper guideline before you know that you're taking it day in, day out. But some people just take it like for every after sex or after intercourse to take it. You understand? And then you seem to see that someone that was supposed to see his flow on the first week of the month will end up seeing the flow at the third week of the month. So, like right, what you have said so far, I think it's also another factor people have to look at it. Proper medical drug information has to be passed out to our people, because people just use these drugs because, and most of them even know why they're taking that drugs, because our friend is using that drugs. And he now refer, did you take this drug after this social so exercise? You understand? They now buy it and then they start using without knowing. Some they don't even read about the drugs. The only thing they read about is how to diagnose themselves. Just you are feeling a headache, the next thing is Google. You check why you are feeling it, and you start prescribing yourself medication. So this case of hormonal imbalance is a very serious case.
It is.
Because I can assure you that it's one of those conditions that has given rise to a lot of issues, starting from missed period, infertility. Because in fact, a lot of ladies could have hormonal imbalance. Is one of those things that could predispose them to infertility.
Of course.
And at the end of the day, they will always center that it's family people or village people, as the case may be. So thank you, Mr. Bute, for taking your time to list some major causes of hormonal imbalance. I want us to look at the signs of this hormonal imbalance, because it's a serious case that we need to look at it.
Yes. Okay. Let me just continue from where you stopped, because you've mentioned one already: infertility.
Okay.
Infertility is one of the major signs of hormonal imbalance.
Okay.
Yeah, because like I explained how the body works when it comes to reproductive health. There's a particular hormones that is being produced when you are pregnant. Whenever the hormone is not available, the womb cannot actually hold a baby for 9 months.
Okay.
So once there is a disbalance in that hormone, in that level, there's no enough level of that hormone in your body system, you can't bear a child. Okay, that's where infertility comes. And then the missed period, there are some times where, like you said earlier, sometimes where a lady will see his period for a 28 cycle period, you see on the 15th, and before the month runs down, you are seeing another one. That's as a result of hormonal imbalance, which could be as a result of the post-P you mentioned earlier.
Okay.
Yeah. Or other lifestyle like taking of alcohol, drinking alcohol, excessive alcohol, smoking. So one of the symptoms is infertility. Okay. Second is tiredness and fatigue.
Okay.
Of hormonal imbalance. For example, postmenopausal women, people who have grown the age of have reached the age of menopause. Within that period, there is a switch in the hormone.
Yeah.
So when that happens, there is these symptoms: fatigue usually setting, tiredness, and even anxiety setting.
Okay.
As a result of hormonal imbalance, because there's a drift shift from the hormone where the stage where they bear children to a stage where they don't bear children anymore.
Okay, sorry. Talking about this, we'll still get back to the science.
No problem.
Talking about this menopause era in the life of a woman, when we were growing up, we were told that a lady has to reach a certain age. Some they say 40, but lately it's no longer that. You can see someone at the age of 35, and it will clinically be ascertained that the person has reached menopause. So are you saying that lifestyle modification could predispose one to this thing before time?
It's not could, it is.
It is. So obviously lifestyle, like because I know most of us live sedentary lifestyle in which we don't want to do exercise.
The thing with Africans generally, they believe that there are some certain activities you do, you are actually stressing yourself, which is not true.
Okay.
Yeah, which is not true. Like a manager sitting in the office, always calling Mr. B, Mr. A to bring this. He feels that he has reached a level where he doesn't need to stand up, which to me is not true. Because that's the genesis of sedentary lifestyle.
Yeah, sure.
Yeah, that's the genesis.
From
you don't
AC
sit down from morning till evening. After, then you now go back to AC. From there, you drive home. From there, you are just not
static,
active. They are just not active.
Some of them AC in the house.
Yes.
AC in the car to office.
And then in the office they just sit down
AC
and call
in the office,
or because they feel
from AC into
they feel
the
they
car
are
back home.
they've reached a certain level where
They don't need to
stress. Meanwhile, that's not stress.
That's not stress.
That's not stress. That's sedentary. That's the genesis of sedentary lifestyle.
I think generally Africa we equate big man to being lazy. Why would I say
Very
that?
correct.
Once you have money in Nigeria or Africa as a whole, you don't want to do any other thing. You just feel that
your money should work.
Money should work for you. Yes, there's nobody that doesn't like freedom or maybe doesn't like rest. But a walk around your compound is not lack of freedom.
It's not.
It does not show that you have money. And if you look at the whites, for example, you can see someone that is up to 70 years still being very agile. In fact, I think the recent studies have shown that lifespan here has been so short. I think we are looking at, is it 50 now, but
yeah, I think so.
50 it's not even up to 65 again. We see a lot of young guys some of them barely 45 are dying. It's not because they have any physiological condition or any health condition, or some of them is stressed.
It's stress.
The stress has piled up over time and they will just collapse and then they will die. So I think what you have said so far, it is one of the key things, because lack of activity is also a very key factor. In fact, even this infertility you are talking about, some men are also culprit. But because the women are always at the receiving end.
Yes. Let me even get into that. Another sign is sex drive.
Sex drive.
When you find out so sudden that you're always into having sex always, you don't just know why there's no
interest again.
There's no interest in sex all of a sudden. It could be as a result of hormonal imbalance, because hormonal imbalance actually decreases libido.
Yeah, sure.
It decreases libido.
Yeah.
Secondly, it increases dryness of vaginal dryness.
That was very common with ladies.
Yes, which is very common with ladies.
Very common.
So sex drive reduces with hormonal imbalance.
Okay. So in the aspect of sex drive, do you really think it's just hormonal imbalance that could cause that?
Not really.
Because there are conditions that could make you lose interest in sex as a man.
One, anxiety can also make you.
Anxiety
and stress also can do that.
And stress. Yeah. Yes, I know that, because.
But the thing is, some of these things I just mentioned, they are still in one way or the other related to hormonal imbalance.
But bad relationship could also make you lose interest in sex.
If you are not attracted to the person sexually,
okay.
Yes, yeah, it can. However, it's more like a secondary cause.
Okay, it's more like a secondary cause.
Yeah.
So in the aspect of libido, hormonal imbalance plays a very key role.
Very key role in libido.
Okay. So that means for both male and female, they have to checkmate themselves when it comes to this.
Of course.
Because from what you have said, I've learned that stress and then fatigue, the lack of exercise could be a major factor as why a whole lot of people lose interest in sex. Yes, I can understand. But me, I'm also putting out to you that bad relationship could also make you lose interest in sex.
That might be true. I've not been in a bad relationship.
So I'm not saying I've been in one, but I'm just telling you that could also be a factor.
Yeah, maybe we need to look into it.
We'll see. That's why we are here. So we have mentioned some, I think, like 3 signs.
Yeah.
Then we'll also talk about mood swings. I think you mentioned
of course, yes.
A lot of people, you walk into their office, you greet them in the morning, maybe good morning, sir, good morning, ma. Like, they're always very
some
very
of them are aggressive. Like, you don't just know why they're aggressive. There's no reason. Even them don't know why they're aggressive. They don't know. That's mood.
So that means hormonal imbalance could also be a factor.
Yes.
As to why a lot of people have mood swings.
It is. And another thing again with hormonal imbalance, it can actually reduce the hydration of your skin. Yes. It is. Hormonal imbalance is a whole lot of topic actually. It's a whole lot of topic.
So are you saying that hormonal imbalance is directly proportional to dry skin?
Not directly actually.
Okay.
Or it can.
It can expose one to having dry skin. I seem to get that one, because I know there are some medications people use to correct that. You understand? People that have dry skin, they always say take more of this, take more of that. You understand? Like I know for a fact that men produces more collagen than women. That's why you see a lot of collagen supplements are out there.
Yeah.
Men actually wingles slower, but die sooner than women.
Yeah.
But just that a woman will always feel old, but will still die old at old age compared to men. Because you know, a man's once your testosterone level drops, the old age, internal aging starts setting in. You understand? Because the collagen level has also dropped. And that is why you see a lot of ladies are on collagen. So they don't even want to know why they're taking collagen. They just say it's for your skin, it's for your skin, it's for your skin.
Like I told a friend some time ago, with time, I told the person that me personally, I might like to go into oncology pharmacy. You know why? Because with the production of things that we are seeing in the next, I'm not saying that, or I'm not praying bad, but it is what it is. In the next 20 years, you see that a whole lot of skin cancer will come up. Because of things that are going on. A lot of supplements, some don't even have. They don't even have.
I think I had one the other day.
They don't even have a name. Some don't have company. They just bring it into the market and start selling.
And the women are vulnerable to this.
Yes. So
because as a man, you can go for 3 days without using cream, and nothing disturbs you. But as a lady, face cream, face wipe, face this, face that. Before you know it, a whole shelf for face. And most of those products are never tested.
Never.
Then going in back to supplement, like a whole lot of supplement out in the market that sometimes I even ask myself. In fact, I think the other day I saw a supplement, they say BBL something. I was like, has this thing been tested?
Now you ask them, what is the pharmacological approach? Like, how does this thing increase as in quote? How? Like, have there been an explanation on how
this thing
works? That increases the muscle of the gluteus muscle? How does it work?
I think this hormonal issues is something that a whole lot of, and sometimes people are even the one predisposing themselves to it.
Yes.
Because taking medications that you are not meant to take. Okay, let's just use for example a case of vaginal discharge. You know what happens to vaginal just hormonal issues. Once you disrupt the normal flora of yeast, where it's supposed to be the normal level, once you disrupt the normal level, it could lead to vaginal discharge, and that could lead to various vaginal issues. I came about a product that someone said you have to put in your vagina for a period of 3 days. You understand? Then it helps to clean the vagina. You know, I was like, is this product, has it been tested? I was trying to get, you understand? Say you have to put it in your vagina for a period of 3 days, it cleans your vagina. So I was like, these things will disrupt the normal flora of the vagina. The vagina has a way of cleaning itself or herself, as the case may be. You understand? And now you are inserting a foreign body into it for a period of 3 days, which we are looking at almost 48 hours. How many hours we are looking at?
70 something.
Okay. That's what we are looking at. So you want to keep it there, a foreign body. And before you know it, you disrupt the normal flora of the vaginal fluid. And as such, you start having foul smell coming out of them. So those things are, I think, a lot of hormonal issues. We ourselves also predispose ourselves to that. Because if you look at you're buying a product to use in your private part for a period of 3 days, it has not been tested. And most of these products, they are not selling out in open market. It's all these our local vendors that they're always posting on their various social media platforms, and they're selling this product.
Online marketers.
Yes, sir. Thereby exposing people to these hormonal issues that we are talking about. And like you have rightly said, I think in the next couple of years, it will be bad. It will be worse than this. A lot of conditions that have no name will come up because of these products have not been tested. So we have discussed some signs of these hormonal issues. And then we have looked at the mood swings, because I must tell you, a lot of people are sad, like they are very moody. And some of them don't even know why they are moody. And they always give this excuse of, that's our nature. You understand? But it's not. So how can we get diagnosed of this hormonal imbalance?
Okay. In diagnosing hormonal imbalance, basically it's through blood test.
Okay.
You do a hormonal profile.
Okay, hormonal profile.
Yeah, like I said earlier, there are different examples of hormone. When you say you have hormonal balance, it's not necessarily mean a reproductive hormone.
Okay.
Because if you are suffering from diabetes too, it's a hormonal issue.
Yes.
I don't know if you understand.
No, I get.
If you have mood swing, it's a hormonal issues. If you have lack of sleep, that's insomnia. It's a hormonal issue because it's hormone that actually control some of these things.
Yeah.
So you actually need to do a hormonal profile. You do a blood test to know which
of the hormone
you are lacking.
It's lacking.
I don't know if you understand.
I understand.
So you cannot just walk in and say, I'm having hormonal imbalance.
No, that's a point because I'm always
now
concerned.
I will ask you, which of the hormones are you lacking?
Are you lacking or are you having a defect? You understand? That's my point. I'm always like, you say you're having hormonal imbalance. Which of them?
Because there are a lot of hormones that controls different things in the body.
Yes.
There's hormone that control metabolism.
Yeah.
That's insulin. There's hormone that control reproductive health, estrogen and testosterone. There's a hormone that control your pituitary, your hypothalamus. So there are a lot of, so the best way to actually know that, okay, is through that hormonal profile, which is blood test.
So that means hormonal profile, hormonal assay is the best diagnosis when it comes to hormonal imbalance.
Yes.
So before we go, because in VitalDee, we're always preaching that all we do is to bring health tips clear to your nearest doorstep. And to our viewers watching this, I want you to know that a whole lot could happen when it comes to hormonal imbalance. In fact, it could predispose you to a lot of dangers that some of them will still discuss. So I want you to just pay attention and get this and share it to your fans or share it to your friends as well, so that they can understand that whenever a medication is being prescribed for a particular condition, it's not because it's a general thing. You understand? You can't buy one drug and you say you're having hormonal imbalance. You are buying that a particular product for that particular hormone that you are having issue. You understand that you're having a defect. So I want us to look at the treatment options that might be available for this hormonal imbalance.
Okay, thank you very much, VitalDee, for this opportunity once again. Before we look at the treatment options, I want us to look at the possible prevention towards
hormonal issues,
especially the lifestyle modification. Okay, one of the things that can actually help you, checkmate your hormone is very important that people don't pay attention to. Drinking of water.
Drinking of water.
Always drink water.
Okay. Stay hydrated.
Stay hydrated. Now, the water don't just make you stay hydrated. It helps you cleanse up toxins in the body system. Okay. And some of these toxins can disbalance your hormone. So when you drink water, it helps you cleanse a lot of toxins in your body. I see some people waking up very early in the morning from bed. The next thing, they are taking carbonated drink. I don't want to mention any brand. They are taking carbonated drinks. Ideally, if you wake up early in the morning, there are a lot of toxins that have been deposited everywhere in your body system. The first thing to do is to drink water. Drink a lot of water. Even before you brush, drink a lot of water. Okay. So, secondly, exercise. Exercise.
I think lately people are taking the exercise like very serious.
Yeah, because you started gym anyway. So you will see people in the gym. However, there are still a lot of people outside that they don't have business with exercise. Okay. They feel there's no time. Secondly, they feel, why do I want to lose weight? Why should I go to the gym? You are not gymming to only lose weight. Okay. You don't gym to only lose weight.
Some people when you work out, carry irons or maybe heavy weights.
well, that's for bodybuilders. Yes. But when you go to the gym, there are a lot of things you can do that don't even warrant you touching iron.
Of course.
Okay. When you exercise, when you gym or not necessarily gym.
Not gym. If
exercise.
You walk in your compound is something.
Cycling. There's a hormone that is released when you do exercise. We call it endorphins. In fact, the topic of endorphin cannot even be discussed. It's a broad topic. Okay. So when you exercise, a lot of these things, you really don't need. Like I tell people, over 10 years now, I don't know how the hospital look like.
Yeah, bless up because
and not because you can say thank God, of course, thank God, but there are other things I'm also doing that does not warrant me going to the hospital. One, I there's no day I don't do exercise.
Okay.
Yeah, like for the past 10 years now, I exercise at least 8 to 10 hours per week.
Okay, 8 to 10 hours per week.
Per week. Yeah, so
Okay, that's good.
exercise is very key. Secondly, eat healthy food.
Healthy food.
Healthy food. One of the things now that we are lacking in this our region is healthy food, nutrition, good balanced diet. Somebody will eat rice in the morning and eat swallow in the afternoon and with soup, and he concluded he has taken balanced diet. Why? Because there's a little protein inside.
I eat yam in the evening.
That's not balanced diet. That's not balanced diet. So if you eat healthy balanced diet, I don't think you even have issues with some of these things. If you can eat fish every day, because fish contain a very, very good nutrient that we are overlooking. Fatty acids. That's omega-3. Fatty acids is a very, very good nutrient that, in fact, the hormone we are talking about, like I told you, is a chemical messenger.
Yeah.
So there's a chemical composition that makes up a hormone. And this fatty acid is one of them, lipid. And then you get this fatty acid from normal food. If you can take them every day, like fish. If you take fish every day, you shouldn't be having an issue with hormonal imbalance, especially when it comes to reproductive health. Hormones.
We should switch to fish.
If you can do fish.
How about fruits?
Yeah, fruits. Beautiful. Fruit, beautiful. Yeah. Fruit, you get things like vitamin C inside, which you talk about collagen.
Yeah.
And vitamin C, the role of vitamin C in synthesizing collagen.
Yes.
So when you eat fruits, there are a lot of vitamins. In fact, we in this part of the country now, we have overruled the vitamin aspect of the 6 classes of food. What we look at is protein, carbohydrates, what else? That's the main thing we eat here. Protein, carbohydrate. We don't talk about mineral. We don't talk about vitamins. Those things you get them from fruits, minerals and vitamins, and they are very key. They are very, very key.
Okay.
Yeah.
So you have mentioned fruits, and I want to come in this way because when we talk about fruits, I think it's one of the most important thing in fact, diet on its own. Recently someone approached me, a man. I think this will also be a topic on its own. He was asking me that he was being diagnosed of his sperm not being of quality to fertilize egg. Okay. So I told him that food could also be a factor. What you eat could be a factor. So I now started telling him, when last did you take something like walnuts? He said, he has not even tasted. I said, okay, what about something like even spinach? What about something like dark chocolate? Do you understand? So what things that contain zinc, do you take them? So, fruits, I think awareness is also a big factor that we're having here.
It's true.
Awareness, community awareness, when it comes to health of what we eat, it's also very vital because most people spend time, and lately all this canned food that a lot of people are buying recently, like it's something. You don't know the preservatives that is being used on those food. But because you have money, you just feel that because you can be using your money to buy.
For example, now I think they cook stew in can now.
Yeah, no, it's
so assuming let's assume that you made stew in your house without putting it in the refrigerator, without warming it. You leave it like that. In 2-3 days, 2 days maximum, depending on the temperature of the environment, the soup will spoil. Or the stew will spoil rather. Now, they made a stew for you and put it inside one can and keep it for years for you to come and buy. You will not ask yourself, how were they able to preserve it? Which chemicals is used in preserving some of these things? You think it doesn't have effect on you? Like I said, every action has a reaction.
Think, like I said, awareness.
Harmful generally. Anyway, for some of you, me personally, I don't eat outside food. So
when you say for some of you, I don't eat outside food as well.
If you say so,
I don't eat outside food. In fact, sometimes what you eat in your home it stays longer than what you're eating outside.
Yes, I've experienced it. I think I went for a program. I went to a program, and of course, I'm not. I didn't travel with my utensils, so I have to, I have to partake in what they gave me.
Yeah.
And to be sincere, after 5 minutes, I'm hungry again. I'm hungry again.
You know what you eat from home stays longer than what you're eating outside. And moreover, I always advise people, in as much as you want to eat outside, please let the food be warm at least.
At least.
But
or you can go for a la carte.
Do you have the patience? Some food they can say it will rain in 30 minutes.
The reason why I actually talk about a la carte is because I was privileged to, partake in one a la carte. This few moments I was here. And it's nice.
Anyway, good food is also a key to what we are looking at, because hormonal imbalance cut across everything, starting from what we eat, lack of exercise, rest. People don't sleep, like you said.
People don't sleep.
People feel that you need to work. Yes, we need to work home. You understand? We need to work,
it's
but
the situation we find ourselves.
It's a country.
But,
and if you don't do that, they think they are lazy.
But the thing I will keep telling people, no matter the stress, no matter the struggle, once you die, life continues.
No, that one is sure. Life continues.
What you are thinking that you can, is only you that can do it. Die and see. Somebody will pick it up and do it better than you. So you need to take care of yourself.
No, actually, what you have discussed on hormonal issue imbalance is one of the key issues a lot of people are facing. In fact, I think community health should take it up. So when it comes to infertility, you understand? Some of these guys that have reached the age to put to bed, or women, they have saline health, and now this infertility have set in. Some of them because of the conditions they are having. Some of them because of, like I mentioned, the lack of. Okay, for example, if your sperm is not healthy enough, you cannot fertilize egg.
Of course,
you cannot get a woman pregnant. But the women will always be like they are not able to give birth. Whereas the man,
not always.
Yes, which is not always. I always tell people, before you condemn a lady of not being able to conceive, have you checked yourself? Because sometimes, and funny enough, women, when it comes to that point, will be very busy. Will not follow the lady to the wife to the hospital to get tested and then to know. And because most times, once the man knows there is a problem, the chances of that marriage surviving is still 70% to 30. But once the woman is a problem, the chance of that marriage surviving is 30 to 70%.
Yes.
You know, so men should also be actively involved in these hormonal issues.
Yes, and then let me just chip in, please, for the men. If you really want to have sex and a productive sex that you want to bring a baby out, it is not good to have sex after stress.
Okay.
Yeah. You cannot come back from work very tired, weak, and you think at that moment of your life is the best time to, where sex can actually relieve you of stress. But that's for the pleasure.
Okay.
You cannot get a quality sperm at that moment. You need to be in your relaxation spots. Like, you need to be calm to actually get the maximum. No, that's the truth. That's the truth.
So that means we have to prepare for.
Yes.
We have to prepare for it.
There is preparation for everything.
Okay.
Yes, you need to have your mind have to be made up, like mental preparedness.
Okay.
About the sex. Well, it's just the truth is just in this part of the world that they don't really preach about sex because they see that's carnal thing. However, sex is not really carnal from the onset.
It has never been.
Yeah. Yes.
But do you know that lack of sex exposes you to stress, anxiety itself, like unnecessary anger, mood swings, you understand? Because I recently read a book that says what happens to your body if you stay without having sex for 1 month. Now I got to discover that your hormones level also drop. Your hormone will also drop. Some hormones, like the connection hormone in women, like the oxytocin, will also drop, which will expose you to having like mood swings, anxiety, those bitter experience. Then for men, we talk of you talk about lack of libido.
I agree with you.
When I started, I was like, "Is this for real?"
Yeah,
you understand? So it's but when it comes to for us here, if you talk about it, they will look like you don't have anything valuable to say.
Well, Nigeria is a religious country.
No, we are very religious. We are not practicing.
That's the truth. Nigeria is a very religious country. I agree with you when you talk about reduction in libido. When you don't have sex for a long time, you lose interest for it. Do you know why you lose interest for it? Your libido has decreased. So for those who want to still practice abstinence, that's the best option. If you don't have sex for a long time, you lose interest for it. Okay. How do you lose interest for it? Your libido level reduces. Which is as a result of hormonal imbalance.
Yeah, that's also a result of hormonal imbalance. Anyway, so this hormonal imbalance I think it's a very broad topic. In fact, I want us, as time goes on, I want us to pick one hormone and discuss it. Okay. So that we'll start looking. In fact, I want us to even talk more on reproductive hormones. Okay. So that the men should also know that they have to be actively involved. Because sometimes I'm always sad when I see that the man is a problem, but the woman will be labeled what she's not. You understand?
It's true.
In fact, in some communities they can ban or they can pursue the marriage will just scatter. You understand? Maybe in fact you're married for after like 3 years and there's no child, people start complaining, what is happening? Before you know it, the man may be the problem. But because the woman, everybody always see the woman as being the one to carry the child, they will now put all the blame. Why the man will just be wearing his trousers and be walking around the street. So please, men also have to be involved when it comes to reproductive hormones.
Very true.
They have to also be very, very involved because in as much as a woman has a very vital part to play, you as a man, in fact, without you doing what you need to do as a man, nothing will come up. So hormonal issues is the longer thing on its own. And we need to know this. So we have mentioned some treatment options in which we are drilling on a non-pharmacological treatment. I know we have some medications you could use to manage hormonal issues.
Yeah. There is well, in the sake of knowledge, I might not point out any specific.
No. We just discuss the
there's what we call hormonal replacement therapy.
Okay.
Yeah, it's a drug used in managing postmenopausal symptoms like flushiness, anxiety, and all of that. So we call them hormonal replacement therapy.
Okay.
Yeah, because at that level, there's a stage in life. Every stage comes with its own different hormone level. There is a pre-puberty, there's a puberty, then there's the age where you bear children, then there's that's puberty. Then there's the age where you don't bear children anymore. So at each stage, there is a hormone attached to it. So when a woman drifts to the postmenopausal, there is this drift shift in the hormone. Okay. So that comes with a lot of side effects, and it's so uncomfortable. So it needs to be managed. It needs to be, corrected gradually. So there's what we call hormonal replacement therapy, in the sense that they introduce
an external
hormone to actually sustain that level for a while. Okay. Then the body get used to it. So that's one. Secondly, there's supplement. There are supplements now in the market, tested, approved by NAFDAC and all of that, that can actually help, recuperate you, try to build the body into a very stable stage, very stable state that can bear some of the effects.
Okay.
So there are some supplements supplements in general. These are natural. These are medications that can, help or supplement for the food or for the minerals you couldn't get from what you are supposed to eat.
Yes,
food.
Yeah.
For example, I talk about eating fish.
Yeah.
Eating fish every day in this Nigerian current situation is in fact
investment.
it's investment.
It's a big time investment.
Yes.
Because you are looking at fish.
Because now
Fish now is not
not easy.
It's not easy to come by.
It's not easy to
A
come
small
by.
piece of fish.
And again, is what's the quantity of fish you need to eat to get fatty acid?
The quantity
of fatty acid
that the body needs
per day.
per day.
That's where supplement comes in. However, this supplement, you need to be, you need to talk to your physician.
Yes.
To actually,
I think that
go for
that is a
which supplement will help you, not just going to a store and just buy supplements.
It's a very big problem because a whole lot of supplement people use, they don't know why they're using it.
They don't know.
They don't know. For example, now, as a woman, you might be having wrinkles. Let's just use that one for example. You might be having wrinkles and you're thinking that you're getting old. Now you think that if you start taking collagen supplement, you're helping yourself. Now, what if it's not the deficit of collagen
that is causing the wrinkles?
That is causing the wrinkles that is coming up.
Then you now have excess collagen, which is another issue.
So you think, I think, and people think that they can use. You don't use supplement to treat.
Yes, you don't use supplement. It's an adjunct.
People don't. That's why I always advise people, before you take any particular medication, let your healthcare provider counsel you and know why you should take that medication, the dose you should take it, and also rule out the possibility of drug-drug interaction, and also rule out a possibility of any underlying issues. Because if you have underlying condition and you're taking a supplement that you're not supposed to take at that point in time, you are doing yourself more harm than good. So thank you, Pharmacist Obute, for taking your time to dialogue with us and then to share to our viewers and our audience what hormonal imbalance is all about. But before you go, I want us, what's your advice to people when it comes to hormonal imbalance? What do you think they can really do when it comes to, if they are diagnosed of a particular hormone deficit? What do you think? What's your advice to our viewers out there?
Okay, particularly with regards to reproductive hormone.
Yes, reproductive hormone, because that's the one that really affects a whole lot of people.
Yeah, but very true, very true. Basically, like I told you earlier, exercise is very key.
Okay.
You cannot run away from it. Cannot. So regular exercise is very, very key. Okay. And for those who are diagnosed already with deficit of this, they can either go for treatment therapy or go for supplement. Okay. Tested supplement, approved supplement. Okay. Yeah. Whether we like it or not, we have to come to a reality that supplements has come to stay.
For sure.
It has. Because in this part of the country where we don't eat balanced diets. We don't. No, I can tell you for a fact, we don't. So good supplements will go a long way, especially the ones that contain fatty acids, the ones that contain omega-3, the one that contain GLA, there's what we call gamma linolenic acid. Okay. And then when you are looking at it, you now look at the percentage of the gamma linolenic acid.
Okay.
Yeah, I think the percentage of the gamma linolenic acid inside a particular supplement also matters,
actually.
Yeah. And then you look at the dose per day. There is what we call maximum daily dose of a drug. Yes. So if you don't speak to your physician, you don't even know how many of these do I need per day. Because, and then one thing I discover about people taking supplement is they take it like anti-malaria, where you take it for 3 days and expect boom. No, supplement is not like that.
It's a continuous something.
It's a continuous, at minimum of 1 month plus. Yes. You don't come and buy one card of let me use, for example, evening primrose.
I think I know you are an expert when it comes to evening primrose. I would love us to have a session on that, because that's one of the most abused.
Yes. You are very correct. That's one of the most abused medication.
I would love to have a session with you, which we are going to look at. Though we are not going to do, it's not as if we are doing advert.
No.
But we just want to talk about the importance of that medication, because that medication is very, very important. It's one of the most powerful product that ladies have to be using?
I can tell you for a fact, evening primrose is a wonder drug.
We'll have a session on that.
Evening
But
primrose
for now,
is a wonder
let's just have it as a wonder drug.
Yes, let's just have it as
We'll have another session in which we're going to talk about it on its own.
Okay.
Full episode about that drugs, why people should use it, and why ladies should make it part of their routine drugs.
Yes.
Because I can assure you that I've seen the wonders of drug as well. But let's leave it a topic for another day.
No problem.
So thank you, Pharmacist Bute, once again.
Thank you so much for hosting.
We have discussed a whole lot. To our viewers, thank you. And this is Pharmacist Bute, at least for taking his time to dialogue with us and to share with you people what hormonal imbalance is. In fact, some of the things he has said today, like mood swings, energy, anxiety, I've gotten to know that hormonal imbalance could also expose one to that. Then he also talk about exercise. Please, we need to take our exercise life very serious, because we are not looking at not just staying fit, but we're also looking at balancing our hormone. Because these hormones they are chemicals that are meant to pass message from one point to another. Then we also talk about rest. You need to sleep. You understand? After, you say, all work without play make Jack it all boy. After all work, please try to rest. You need to rest, because when you rest, your body has opportunity to rebuild itself, the damaged muscles, and then replace them. So please, at the end of the day, always try to rest after every work. Then for people that are having issues with hormonal conditions or hormonal imbalance, always ensure that you meet your healthcare providers so that you get proper counsel. Don't just walk into a pattern medicine shop or a community medicine shop and procure yourself a particular supplement because your friend is taking that supplement. You feel if you also take it, you are going to get result. No, there's a condition as to why your friend was prescribed that product. In treatment should be individual based. I believe in individual treatment. You don't generalize a treatment for a certain group of people. So at the end of the day, we have learned so much about hormonal imbalance, and we have also said that men should actively be involved when it comes to reproductive hormones, because at the end of the day, you don't need to be pointing fingers at your woman whereas you can also be a culprit, or you could also be a culprit as to why your lady is not able to conceive. So men also have to be actively involved in knowing more about reproductive hormones, because if your hormone is not how it's supposed to be, you could also be the cause as to why your woman is not able to conceive. So thank you very much for spending time with us today, from Asisopute, and telling us what we need to do. And then to our audience, please don't forget to subscribe, share, and then tell people about us, because all we just want to do is to bring health tips closer to your nearest doorstep. If you have not subscribed, please hit the subscription button. Thank you.